Dosing is one of the cornerstones of the well-known equilateral triangle of dose, set, and setting. So the three have the same importance. In the following, I will talk naturally about my very own work, a rather psycholytic approach.
Friederike Meckel Fischer is trained as a medical doctor in Germany, and she also retrained as a psychotherapist. She has loads of credentials. She trained in Holotropic Breathwork with Stanislav Grof and completed a psychedelic psychotherapy training in Switzerland in the early 1990s. She also trained as a couples therapist, a family therapist, and a family-constellation-worker. And in the mid-1990s, she introduced the use of psychedelics into a psychotherapy practice, working underground with specifically chosen clients in particular groups. Although she is not working with psychoactive substances anymore, she still engages in the field, sharing her experiences as today. So welcome, Friederike.
I used LSD, MDMA, and 2CB, and now I will talk about their dosing and about combining. Naturally, after all these lovely people spoken here, I assume common knowledge about the effects and the efficacy of the substances. Dosing is one of the cornerstones of the well-known equilateral triangle of dose, set, and setting. So the three have the same importance. In the following, I will talk naturally about my very own work, a rather psycholytic approach. I was not in research. I researched without knowing that I researched. Second folio, please. Some general remarks on dosage. Terms like high dose, low, and normal dose are relative. The data vary. Some examples: low doses are mentioned by some authors as to 30 to 200 micrograms with LSD. In the Psychedelic Explorer's Guide, James Fadiman considers 150 to 400 micro a normal dose. My goodness. High LSD doses are generally managed in the literature between 400 and 1,500 micro. And the normal dosages, as you could hear today from MDMA, range from 100 to 140, 150. So it's about the same, but you all know that little changes in the amount have an effect. And the normal dose for 2CB is reported to be 10, 20, or 25, and 30 milligrams are classified as toxic. So my personal experience is that one individual may perceive, I will tell, okay, one individual may perceive a dose as to be normal, or the other will perceive the same dose as to be too high or too low. So I guess here it is exactly the same as one says in the normal world. The beauty is in the eye of the beholder. One can transfer this. Next folio. So a few words about choosing the medicine in my own setting, which took place from 1997 to 2009. The decision as to which substance to take and at what dose was made in and by the group. One of the advantages of the careful discussion of doses was that there were no irritations on the session or complaints afterwards. We usually decided on MDMA if the majority of those present were addressing relationship issues, think of Annie, or childhood memories, and when it was felt to be important to revisit an event without fear. This refers to the traumatic situations. If the intention was for more general exploration or to solve a specific problem, then we would often begin with LSD, and we use 2CB if the intention was to work on ambivalence, resistance, or psychosomatic issues. Next one, please. In general, the dose for dosages, I stuck to Stolarov's principle of the useful dose, as much as necessary, as little as possible, and the necessary results from the intention, which implies that one should have an intention. So we always dosed by the individual based on the experience of previous sessions. And as I said before, it was really very important that the client always knew about his dosage and could discuss it and then be content. Next, please. A word to MDMA. I always did a one-to-one MDMA session with the client first. On the one hand, for the client to get to know and trust a psychoactive substance and to get my full attention. For me, to experience the client in this state. Mostly I had experienced him before in holotropic breathwork, but that was a little different. So I did a one-to-one session first. And for the two of us to really enter a mutual relationship. And only when the client had decided to continue, I introduced him to the group. So this was some kind of protection for the group too. The initial dose of MDMA was usually 100 milligrams, and in some cases even only 90, and I had a good reason for this. And after a first acquaintance, I administered 120 as a normal dose, 130 for very withdrawn or rigid clients, and 140 milligrams as the maximum on special request. We never actually boosted, so the question didn't really arrive, but to lengthen the process, we did something else, as you will hear later. Next, please. About LSD, you all know LSD has a dose-dependent effect. The larger the dose, the stronger the experience. It is not only my conviction, but my experience that one really has to learn to be with this very substance so that one can remain in an inner balance with different dosages on the long run and not be overwhelmed by images and emotions. And this I consider very important to remember and then integrate the experience. So for me, the first dose for a drug-naive person is 50 micrograms. It puts him in a sort of hallucinatory and emotionally charged situation, and he learns about this. In time, and we didn't have a certain number of sessions, they just came and continued coming. In time, each client could tell what amount of LSD he felt the most comfortable with. And then eventually we would go a bit beyond this comfort zone when he felt that he wanted to look a bit more intensely or to really do something important. The LSD, because I think it's a very challenging substance, I always gave initially only as an adjunct to MDMA. In this way, the LSD is experienced as less harsh and confusing. We increased the LSD doses slowly in 25 or better 50 microgram steps individually. And this had the effect that the clients really got used and were able to follow the inner process. The maximum dose in my setting was 250 micros. We had a group of 12 to 16, so I think this was the best to handle it. We also took LSD as a single substance without combining it. And then this was very interesting. I allowed them to choose their dosage. And although we were on different dosages, we all ended up in the same realm. Next folio, please. The third substance I used was 2CB. I say a few words about the substance as I often find or hear that it is not known to very many. The 2CB is not an easy substance, especially for beginners, because the unfold is so different. The ascent happens like in several steps. You take it And then after about half an hour, you think, oops, I'm fully lucid and I'm done. But then you look at your watch, it's only half an hour. So then I said, please lie down again. Then the opening continued almost until a second floor. So, and this happens 3 times, and then you are actually on the peak. So it's not as gentle as with the MDMA, but like with the MDMA, one can experience an opening of the heart. It is not as euphoric or sweet, and the thoughts are very clear, similar to LSD, but not so sharp. And the presence under 2CB is extremely good. The centering really easier than with LSD. On about 20 milligrams, one has these mescaline-like effects. It is really very good for if you want to look at your dark sides, the shadow. There, the 2CB is brilliant. It shows you really the criminal within you, or when you have resistance problems or psychosomatic problems. The descent is a bit gloomy, unfriendly, lethargic. And for this reason, I like to give 60 to 80 milligrams of MDMA for a soft landing. One can give LSD for a better landing too, but then the process goes so long. For me, I found that an exact dosage of 22 milligrams is just perfect. The advantage, or you may say the disadvantage of 2CB is the short duration of effect. With 20 milligrams of 2CB alone, you are out for about 2 and 2.5 hours, and then you are back. The next folio, please. About combining. I didn't invent the art of combining substances. It is already described from Stoloroff or Hubbard in the 50s. And I also experienced and learned how to combine in my training in Switzerland. And as you may know, the combination of LSD and MDMA is called candy flip. So one can actually say, generally observed, the higher dosed substance puts the stamp on the experience. However, the specific qualities of the 2 substances, they influence each other. Something like when colors flow together. So as I said before, the sweetness of the MDMA is reduced and the sharpness of the LSD is diminished and the edginess of the 2CB is rounded. Now, specifically MDMA and LSD, since I did therapeutic work in the group, the time frame of MDMA was too short to really work with every single one. So one reason of combining MDMA with LSD was to lengthen the process. The other reason was to introduce LSD. I said this before, and the effects were the same. What we then did, and since I wasn't a researcher, I didn't write it down, because when you work underground, you don't write down so much. We tried out in different time intervals between the 2 substances. And this was really a very interesting time. The timing is important because each of the substances has the specific qualities. And so the second substance sort of transposes the experience into a different key. Next folio, please. So the timing, taken the 2 substances together or very shortly after each other, one usually experiences a very impressive, longer lasting peak that has the opening and the sweetness of the MDMA and discreetly diminishes the effect of the LSD. But it really is an overwhelming, big realm with very deep insights that have this very strong affirmation of the LSD, of the MDMA, and the big light of the L. For me, the best time to add the L seemed to be when the MDMA was still on the plateau, not yet about to descend. And in this way, one didn't experience a real second ascent. The LSD flooded in smoothly, very fast, and the MDMA coloration remained. Waiting with the LSD dosage until the end of the descent of the MDMA was felt meant a second ascent, and the quality of the LSD was more present then. In numbers now, I first gave 100 milligrams of MDMA, and after 2 hours, then I added 50 micrograms for beginners, or for the more advanced, a little more. That was it. Next folio, please. About combining LSD, then the LSD first with the MDMA. There again, the LSD was then more in the foreground, the MDMA less emotional, somewhat sober, but with the heart opening in a sober way. It's a very interesting feeling or state of being. But it gives the LSD a greater emotional range, not so overwhelming as without the MDMA. And I found that the LSD experiences were become more authentic and sustaining, especially, and where they were full of emotionality, and the integration seemed easier. The initial dose in those was 50 to 75 to 100 micrograms, and I added between 80 and 110 milligrams of MDMA. Next folio, please. Now, again, about the timing, taken together, it is the same as I said before. And since, so I jump to the next step, taken directly after the peak of LSD, the MDMA is more an adjunct. The influence is not that big. The LSD gets a little slower and emotionally, but this is dose dependent too. And the next taken when the LSD still was on the plateau, but close to the descent, gave the process a clear towards a loving view of what had been experienced and recognized and understood. I think I generally should say taking a second substance at this moment is a very challenging matter, since the first substance is still working. When the second substance starts to unfold, there comes a moment when the two meet. And at this intersection, one has to be very still and very quiet, because this moment, when it's a short moment, but it comes, you feel totally sober, as if you haven't taken anything. You think, oh, what's wrong now? Totally sober, and then the second substance takes over, and sometimes this is more powerful than it would be taken, than as if it would be taken alone. And this is because it arrives on the crest of the wave of the first substance. So that one really has to lay down very quiet, nice music, and then it unfolds unbelievably. When we took the MDMA, when the LSD was already wearing off, this really meant a definite second ascent, which sometimes then led to totally different perspectives on the topics worked under LSD. Like, you read a book in a different language, and the wording is different, the meaning is the same. Now the third one, the next folio, please. Now putting together the MDMA and the 2CB and vice versa. Beforehand, one can combine the 2CB with LSD the same. I didn't elaborate about this, it would have been too long. So I just talk about MDMA and 2CB here. These two substances behave sort of antagonistically. So it is favorable to let MDMA run out quite far. The best time to do this is 2 to 2.25 or 2.5 hours after taking the MDMA. I said before, the MDMA and the 2CB are good together because the 2CB is a little unpleasant at times. Well, MDMA first and then 2CB. The MDMA prepares the body and the mind wonderfully. So when you then with the 2CB want to look at something really nasty, you can do this without having this nastiness. And if you take the 2CB first, we did this if our primary intention was to look at unpleasant subjects. And I like then to start with the 2CB, and the empathogenic effect of MDMA felt a little different, but very pleasant, and the unfriendly descent of 2CB was intercepted. So next folio. Although I spoke specifically about dosages, I have to remember or to remind that set and setting must never be lost or from sight or sense. I'm convinced that one has to have a goal for a psychoanalytic session. I think that one has to engage into a relationship with a substance, because we can't just take them and use them. A relationship is necessary. And I think that we should have dosages that there can always be an awareness at all times, so that the findings and insights can be transferred to the consciousness and to the body level. So finally, combining substances is something very exciting, at least was for me. It was a pleasure to remember, since we did this underground. I had not written down, as I said before. So I thank you for this wonderful kick into my past. Thank you.